Hi, my name is Jessie Orchowski. I'm here with Katie Searfoss. And what a lot of people don't know that it's RSD Awareness Month, and you have RSD, right?
That's right.
So we're going to kind of talk about that today. So first of all, can you tell me what RSD stands for?
RSD stands for reflex sympathetic dystrophy.
Did you say her name, Katie?
Yeah. Am I doing that again? Everything? Hi, I'm Jessie Orchowski. I'm here with Katie Searfoss, and we're going to talk a little bit about RSD Awareness Month. And actually, you have RSD.
That's right.
So first of all, can you just tell me what that stands for?
RSD stands for reflex sympathetic dystrophy.
Okay, and can you tell me a little bit about what that is?
Reflex sympathetic dystrophy, or it's easier just to say RSD, is a pain disorder where there's a miscommunication between your nerves and your brain. And the problem then is that the nerves are sending bad signals to your brain, and your brain is sending either too much blood or restricting too much blood to different areas that end up causing excruciating knife-like pain.
And how often do people feel this pain?
Well, unfortunately, it's typically a 24/7. As soon as people experience pain, it doesn't go away. For some people, they can experience relief throughout the day, but for the most part, it's all day, every day.
Is this a rare disease?
Actually, it's a underdiagnosed disease. So, yes, a lot of people you wouldn't think of would have it, and many people probably have never heard of it before. However, it's actually just underdiagnosed, and a lot of doctors actually don't even know what it is.
So it doesn't come up in blood tests?
There's only one test that it will show up in, but it's very uncommon. And typically, people only do it to confirm that you have RSD, but for the most part, doctors see it more in their symptoms of pain or how it looks on their body.
Oh, okay. So how do you think that this affects people and how they live?
Pain changes people. Pain changes when all of a sudden you live your life with no pain to excruciating pain all day, every day. It changes how a person is. It changes personality. It changes friendships and relationships, and it changes just everything that you do on a day-to-day basis is completely rocked because all of a sudden you're doing it with pain.
That's a shame. And then how is this caused? What brings about this disease?
Well, commonly, see the problem is there's not one thing that causes it.
Exactly, yeah.
Commonly, the issue is an injury. So someone might have a sports injury, someone might have just fallen down the stairs, someone might have gotten in a car accident, any sort of injury that doesn't heal properly. So typically when you get hurt, the doctors will say, all right, 6 to 8 weeks, we'll cast it up, we'll see what happens after that. This would be like above and beyond that, it's not healing. So people are like, well, this is weird because my broken foot is no longer broken, but it still feels just as bad as day one. And then that's when people start looking at it in a different way. Unfortunately, then there's some, and I'm one of these patients that don't have any rhyme or reason. It just happened. Those are probably the harder ones for doctors because they go by the book, and textbook usually says that injury is the first sign of then a pain disorder.
And would you think that might be a symptom, and what symptoms might this?
A lot of symptoms for people, well, besides obviously the excruciating pain, is that visibly there could be swelling or change of color, change of temperature to the touch. You could touch your foot or any ligament that it's in, and it could be cold to the touch, like extremely cold or purple. It could have spots all over it. It would look visibly different. Now, for some people, they don't have any visible signs. That's one of the hardest things that people with RSD face, is that because it's misunderdiagnosed, if they don't have visible signs, a lot of times they get told that they're making it up or that they're exaggerating their pain.
It's like in their head.
Exactly. And that's extremely hard for people because then they're facing this idea that no, the pain that I'm feeling isn't real, but it is real. It's very real. You just might not have all of those symptoms, but signs to look for typically are if an injury does not heal, keep an eye on it, and if there's anything different visibly when you look at it.
What does it feel like?
People describe it different ways. I would describe it if, when you step on like a nail or you step on something sharp, your instinct reaction is to pull away from it. But if you were to step on that, needle, that knife, that whatever, have that pressure down on that ligament
Without
pulling away. That's what people feel. So a lot of people describe it as knife-like. A lot of people describe it as barbed wire. A lot of people describe it as needles just being injected all the time. And a lot of people describe it as fiery and burning sensation. Honestly, it's really excruciating torture-like pain. And that's why it gets so complicated when doctors don't diagnose it. Because then they're saying, no, you're making it up in your head. And honestly, who would make up something so horrendous like that?
Is there a cure? Is there treatments?
Depending on which doctor you go to, it will depend on the treatment. There is no cure as of right now. There are treatments that work for some people and do bring people relief, but there's not one universal cure. It changes on different doctors' beliefs. Some treatments are just simply to retrain your brain by doing physical therapy and occupational therapy and trying to teach your brain that, we want to get you moving and get you realizing that the pain, you can live with it. And it will somehow subside. That's what some doctors believe. There are medications. The thing about medications is there's not one universal medication that works. So it's a lot of testing and trial and error and seeing what happens and what works. Or some people get diagnosed and are in the hospital then with it. It just depends. And it also depends on how young or old the person is when they get diagnosed. Typically, the younger you are and the earlier that you get diagnosed, the easier it is to treat. The longer you get diagnosed, the longer away from diagnosis, and the older you are, the harder it is to treat.
Really? And then, are there stages of this disease, like that go from not so bad to maybe worse?
Yeah, I would say that for some people it's horrendous ever since day one. Oftentimes it gets worse the longer it's untreated, and I personally believe that not getting any sort of treatment, and that can be between you and your doctor, but not getting any sort of treatment is really detrimental because that can typically make it worse for a lot of patients. Stages then, could include then more visible reaction. For myself, I feel like the pain was always horrendous, but I learned how to tolerate it, and I am still in excruciating pain, but for me, visibly on my face, you could see that I was constantly in pain, whereas as I've learned to cope with it now, it's still awful. I still want to be an advocate for it because it still runs my life, but I at least can still live my life.
Yeah.
But over the years, it has become more visible to me because it took so long to diagnose me.
Now, is there like a medication or like a vaccine that you could take to maybe make the pain go away?
There is one treatment. It's called the ketamine coma, except it's not common for people to do this. You have to kind of go to extreme measures to want to be a part of that. Well, it's not so much that it has to be bad. It's just that you have to be willing to put your body under a lot more stress in order to do it. It's not something that the States has legalized yet. So doctors send patients out to other countries to induce a coma, to try to literally shut down your brain, and then in hopes that in 3 days when they kind of jumpstart your brain, that your sympathetic nervous system will kind of just restart and rewire itself. It's very dangerous. There's a lot of serious side effects from it and consequences from it, but some people just feel so desperate to get rid of this pain that they would do anything. The States does legalize ketamine treatments, which would be injections or infusions. There are other infusions that again, it helps some, it doesn't help others. I've tried a lot of different treatments and it's yet to help me. And I know a lot of people who have gotten relief from different treatments. So it really depends on the patient.
Okay. And now, do you think that this can be do you think that this could be prevented?
I don't think that it can be prevented because I think that we would have to live in a world that's way too safe to be prevented. You know, inevitably you're going to have a sports injury. You're going to fall. You're going to have broken bones sometimes. You're going to sprain things sometimes. But I do think that the more people are aware that this is a possibility after that, the more people understand what RSD is, the better they can kind of have their medical life be then. Because if RSD were to be something that would approach their body after an injury and they know what it is, then they can tell their doctor that they're concerned about this. And if they're concerned about this and they get it checked out, then yeah, they can prevent a lot of damage that could be done to their body in the future.
Okay, is there anything else that you'd like to add?
No, I think that's great. Thanks.
I'm Jessie Orchowski. I was here with Katie Searfoss, and we talked about RSD Awareness Month and pretty much just how this disease works. Thank you so much. Now back to the Eagle's Eye.